Welcome back. May is Women's Health Month, and today we're raising awareness about alcohol and the impact it can have on women's health. So this morning we're joined by Dr. Joel Cachette, Chief Medical Officer of United Healthcare Medicare and Retirement of Florida, to talk about how to make sure women are having a healthy relationship when it comes to drinking. Good morning, Dr. Cachette. Thank you for joining us. So what do we know about alcohol and its impact on women's health?
Well, a couple things. We know that women's bodies process alcohol differently than men. It makes them more susceptible to harmful effects. In recent years, alcohol-related health risks for women have really increased. The former U.S. Surgeon General recently warned that alcohol increases cancer risk, and alcohol-related deaths among women have increased by nearly 15% in the last two decades.
Wow, interesting information there. What unique risks and impacts should women be aware of concerning alcohol as they age?
Well, for women, binge drinking can be described as 4 or more drinks within 2 to 3 hours. Heavy drinking can be described as 8 or more drinks per week. In the US, 13% of women and over 12% in Florida have been reported as being either binge or heavy drinkers. It's even more concerning for young women aged 18 to 25, where nearly 1 in 3 binge drink. During pregnancy, one of the most important things to remember is that there is no safe level of alcohol that should be ingested. And then also we hear on social media the stressors of motherhood and parenting, and some encouragement for women to have a glass of wine to de-stress. Also, we've seen some increase in heavy drinking by 41% among women after the pandemic, but that puts them at risk for physical and mental health problems. During perimenopause, alcohol can hit even harder. Hormonal changes can make alcohol's effects even more intense and increase risk for heart disease. So throughout life, there's a number of areas and a number of times where alcohol can cause specific problems, particularly in women.
That's interesting. I appreciate that breakdown of not only impacts as women age, but even in their youth as well, just the impacts of an unhealthy relationship with alcohol. So what are some ways that women can improve their relationships with alcohol?
Well, I think it starts by understanding the facts. Sometimes we hear that a little red wine is good for your heart, but the most important thing to realize is that there's really no amount of alcohol that's healthy. There's increased risk of certain types of cancer, including liver, breast, and colon cancer with alcohol. And also that increases risk of heart disease, stroke, and high blood pressure. Make a plan if you do drink. Alternating alcoholic beverages with water is helpful, but most importantly, set limits. Preferably, say, 1 drink or 2 drinks when you do drink.
Dr. Joel Cachette, thank you so much for joining us today. You gave us a lot of practical tools that we can even implement starting today. So thanks again. A reminder, there are resources available to you, as Dr. Cachette just said, to help you or your loved ones find help. You can go to findtreatment.gov. You see it right there on the screen, or call the National Helpline. We've been talking about Women's Health Month all this May. To see more of our stories or to watch this interview again, head to WPBF.com or download our free WPBF 25 News app.